we've had milk lakes, we've had butter mountains, postcode lotteries. But when it comes to teeth, we talk a lot about dentistry deserts. More than 13 million adults, around kind of 1 in 4 of us, are struggling to find NHS dental care in England. This is the result of chronic underfunding, workforce shortages, and, as we all know, a very flawed contractual model. Now, Labour in England is committed to contract reform, and the 10-year health plan has specific initiatives to maximise the skills of dental care professionals. And equally in Wales, the government has announced contract reform focused on prevention, co-production and population health management. No action at the moment in Northern Ireland, but I can tell you that stakeholders there are urging Stormont to take urgent action over what is a deteriorating position. So the question is, what do we do? This is a complex problem which involves acting on a whole number of different fronts, from contracts to workforce to embedding dentistry in neighbourhood working. So what we've recently done at the Confed is we've brought together, in partnership with NEC Software Solutions, a round table. It was just today, actually. It involved a really kind of all-star cast of dental CIC, dental groups, primary care directors, commissioners, patient groups. We all came together to talk about the challenges that I've described, but particularly what might be the core components of a new national strategy, which then feeds down into local strategies. I chaired the event, but all the work was done by Rebecca Gale, Assistant Director of our Primary Care Network, and I'm delighted that, fresh from the event, Rebecca is able to join me on Health Online. Welcome, Rebecca.
Hi, Matthew. Thanks for having me.
Now, you did a brilliant presentation at the beginning of the day just on kind of how challenging the situation is, as it were, the burning platform. I'm not going to ask you to go through all of that, but just pick out 2 or 3 of the kind of compelling reasons why we absolutely need a new approach to dentistry.
Yeah, thanks, Matthew. I mean, you introed with dental deserts, and I think that's kind of a perfect place to start. We have a situation where we have vast swathes of the country or regions that do not have adequate dental care provision. I mean, 13 million adults alone, or people alone, cannot access an NHS dentist. And that's not to say there are not dental practices or dentists operating in those areas, but we have a situation where the proportion of NHS dentists that want to provide NHS care is declining. And that's because of years of underfunding, insufficient remuneration. They are choosing to opt out of NHS and move into the private sector. We have high rising demand, high levels of unmet needs. And I think just a few key stats really. Tooth decay is the number one reason why children aged 5 to 9 are admitted to hospital. And in this day and age, that is shocking. We've got preventable disease, oral cancers on the rise, and people waiting for surgery and for treatments, for cancer treatment, for cardiac surgery, and for support with their long-term conditions, that cannot access that care because they need their oral health needs to be met in the first instance. So this has far-reaching consequences, both for the individuals, for communities, but also the wider implication and impact on system cost.
Thanks, Rebecca. And, we don't bring people together, busy people together, for conversations at the Confed unless we've really thought about it, and we're really interested in change, and we think there's an opportunity for change. So just tell me, what were the objectives of the session that you and I hosted today?
I mean, to put into 3 key words, to convene, to challenge, and to collaborate. Confed, as a membership organisation for the entire NHS, we are in a unique position to join the dots, to describe what we think the opportunities are, and to demonstrate where things are actually already happening. And I think it's important to say that there was a lot of innovation in relation to dentistry taking place up and down the country. Challenge, we're realistic. These are big issues. We say dentistry is on a burning platform, and we didn't expect to resolve or solve those challenges or that conundrum within a 90-minute round table. So the conversation was very much solutions focused. We did challenge the group to think beyond the status quo. There were certain rules of engagement that we couldn't just simply ask for more investment. And really thinking about, in the context of a neighbourhood health service, what is the role that dentistry and oral health needs to play if the government's going to deliver on its ambitions. And then finally, to collaborate, to identify, as you say, we had a great cast list, varying perspectives from across the country, and actually I should say 3 nations. We had Wales and Northern Ireland in attendance as well. So to really think about where is that point of consensus, where can we come together and really build as collective voice, to sort of think about what the narrative should be as we build our influencing work going forward.
No, I found it a fascinating session, and I found it quite mouth-watering in terms of as a policy wonk. I can see the different components that need. I don't know how they should come together. That's the work that we need to do. But I could see the components that would be needed for a fresh approach, a new strategy. But tell me, Rebecca, what were there? You're kind of, I'm sure, starting to process this. You're going to produce a summary and we'll publish it, but just now, with it fresh in your mind, are there any particular points that surprised you that you thought, well, I've not heard that before? That's something to reflect on.
Yeah, I mean, I think perhaps not surprising but comforting was the level of consensus in the room, given the breadth of different organisations, viewpoints people were coming to. I think what really came out for me was the need for honesty and transparency, and for that to come top down, and that is about honesty with the public about what is within our gift in terms of dental care provision, what can we afford. But also with the profession itself, we need to make sure that we are targeting oral health provision to those that need it most. And I think what was also surprising was we talk a lot about digital and tech and where some of that, the opportunity to do more with it and for it to alleviate burden. And I think what was interesting was the caution that came from the whole group about this cannot substitute some basic fundamental need, and every child, for example, should be seeing a dentist, and it's just about making sure that any technological advances or digital advances don't take away from that. Yes, there needs to be literacy. Yes, there needs to be better education, and parents particularly need to be supportive of that, but it doesn't take away from some of those fundamental rights.
Yes, absolutely. And there were loads of things that I found kind of really interesting. I thought the recurrent theme that we are going to have to make choices. And in those choices, we are going to have to prioritize 2 groups in particular, and that's children and the most disadvantaged. I thought how you do that most effectively whilst also having something to offer and something to say to everybody else, how you engage in the market. As I say, really fascinating kind of public policy challenge. One of the elements of the session that I really enjoyed, Rebecca, was some people sharing the good practice they're managing to achieve even in these difficult circumstances. Give me 1 or 2 maybe examples of what you heard today, which you were heartened by as good stuff that people are doing.
Yeah, I think the examples we heard, they're illustrative of commissioners that are prepared to be bold and doing what they can within the constraints of the current contract, but also providers that really do understand the needs of their population, the need for local flexibility, and that one size absolutely does not fit all. So we had examples of providers that have built partnerships with universities to tackle both the access and workforce challenges. But also in terms of outreach initiatives, I mean, we have one example of a community dental provider working with a general dental practitioner, going out to a community, I mean, I can name it Luton, to provide pop-up clinics, and not just a sort of a standalone one-off event, but actually working with that general dental practitioner who can have then the capacity to register patients who perhaps don't have a regular dentist. They're right there on the spot using a QR code, so that risk or that need is captured and dealt with in a way that ensures that patient is not just identified but actually seen through. And of 98 children seen that day, 97% had never seen a dentist.
Yeah, and they were different kind of ages. Some of them were 9 or 10.
Yeah.
Final question. One of the other things I kind of said at the beginning of the event, and which came up again and again and again, was the scope for oral health and dentistry to be part of our neighbourhood offer, particularly in those most disadvantaged areas that Wes is treating, has talked about. He wants those areas to be the ones that lead in this neighbourhood environment. Just tell us a couple of things about what people were saying about this idea of dentistry as an inherent component of the neighbourhood offer.
Yeah, I think fundamentally oral health needs to be embedded from the start, and that it's not seen as an add-on. Historically, it has felt siloed on the sidelines, and as one member said, we need to put the mouth back into healthcare. But it's more than healthcare. And Matthew, you and I heard firsthand on a visit, didn't we, about a patient who at the age of 27 had a mouth full of dentures. And aside from the physical impacts, the wider consequences of that are huge. Their ability to socialize, their ability to work. So if we are to achieve the ambitions of a neighbourhood health service, then that preventative model needs to be at the forefront, and it is it's almost less about teeth, and it's about that whole oral health and the interaction between oral health and the rest of the body, and also the rest of people's health and well-being.
Yes, and also that other key idea that we've talked about always at the Confed when we talk about neighbourhoods, which is proactivity, not waiting for people to come to us, but going out, knocking on doors, engaging with people who don't read don't read leaflets, don't read mainstream media, who may not even know how to access the health service, might come from other countries where primary care isn't the same as it is here. And that we see over and over again that reaching out into communities is absolutely critical to prevention and tackling health inequalities. Now, I said, Rebecca, that I really enjoyed the session, because although it would take me a lot more time and thinking to understand how these bits stitch together, you could start to see the different components of this. You've got to take this next bit of work forward. What's your feeling? Is this, as many people see it, and as I think government fears, it's simply intractable because of the financial problem? Or do you think that what we've heard today starts to take us towards what the components might be of a strategy that is both ambitious and credible?
Yeah, I mean, I think, it's we are, as I said at the start, we are in a unique position. We represent those organizations and those commissions that are charged with delivering transformational change. And today was the start of the conversation. There were things that came up that we've heard before and have been said, repeatedly over decades. But what feels different was there is, this sense of the time is now. We are on the burning platform, and with risk and times of uncertainty comes opportunity, and there's the opportunity here to do something differently. So yeah, I think we can demonstrate the art of the possible. I think we can draw on that group of experts going forward. There is that, as we said, there's consensus within the group. But I came away feeling positive and optimistic. There was some tangible points and some very, there are some ways round the perceived barriers that exist if we look beyond contractual constraints. And we know from the examples we heard from today that some people are already doing this, and it's about how do we support them to scale it up. And with the cut of ICBs, there is obviously a real worry about the reduction in commissioning capacity and expertise, which is why engaging and working with the sector and those delivering these services is ever more important.
Yeah, no, that's right, Rebecca. And it can sound very trite to say hope is important in the face of challenges, but actually it is relevant here, because if politicians feel there is no hope of making progress, it's one of the reasons they don't engage with difficult issues. So I think it's important that we say that there is hope here. All this talk of burning platforms and deserts, I'm going to say this is a hot topic, and I'm sure we will return to dentistry on Health on the Line in the future. Thank you so much for joining me, Rebecca.